Andy Stamus here with Medicare Mindset in the Med Plan Store. This video tutorial will show you how to review your existing standalone Part D drug plan through the Medicare.gov site and ultimately make a decision on the right plan for 2025. Before we get started, a few important things. First, we are only addressing standalone Part D drug plans in this video, not Medicare Advantage HMO PPO plans. Second, you need to create a My Medicare account at Medicare.gov. You can reference our video at the end or in the description below on how to set up the account. Third, you need to enter your medications in your My Medicare account. A video on how to do this will also be linked at the end and in the description below. But I'll show you in a moment how you can add a new medication if necessary. And fourth, if you do end up changing your Part D drug plan during the annual enrollment period of October 15th through December 7th, the new plan will automatically cancel your existing drug plan at the end of the year. We will address two different scenarios based on your level of medication needs. The first scenario is for someone with no medications or inexpensive generic medications. And the second scenario is for someone with brand name medications or really expensive medications. So if you want to jump to your scenario, click on that timestamp in the description below to save some time. Now here we are at the official Medicare.gov website. You want to click on Login at the top right. And on the next page, you can enter your existing login credentials or create an account if you don't have one. We'll go ahead and get logged in. Once you log in and enter your two-step verification code, you'll be at the main dashboard where we'll start with the first scenario, someone with no medications or just some inexpensive generic medications. At the top of your dashboard, you'll see Health and Drug Plans right here. Click on that, and then under Find and Compare, click on Find Health and Drug Plans. The system will show you your existing drug plan if you have one right here. So in 2024, this example person has the WellCare Value Script plan. A little further down, you'll see what this plan is named in 2025. Some plans have a name change, so it is important to verify this before you do your analysis. In this case, it's still the same name moving into 2025. And then a little further down, you'll see your pharmacy lists. So we already have Kroger in here. We'll add one a little later as well. And you'll see your drug list here if you've added any medications. We're going to start out from scratch today in this example. So there will be no medications, and then over time, I will keep adding more medications. So let's click on Find Plans now. It's very important that you select the right plan year. In this case, we're looking at 2025. If you select 2024, it's not going to help you. We need to look at 2025. Continue. Also, very important that you select the right type of plan. We are looking at only standalone Part D drug plans. Right here, Medicare Drug Plan Part D. Do not select Part C Medicare Advantage. That's not what we're doing in this video. Here you can say yes or no about medications. In our first example, at least the first half of our first example, we are not going to add any medications. And we'll add some over time. What it's going to do is show you the results for somebody with no medications. So in this case, it says your next plan. So what it's saying is your current plan in 2024, if you were to do nothing, your next plan in 2025 is this. So it's the same plan, same name as we talked about earlier. And commonly what you're going to notice in this system, at least at the time of when we recorded this, Medicare's website can act up occasionally. Right now, it's not updating, for example, the pharmacies right here. I know that the pharmacy in the system is in network, but right here it says 0 out of 1. You'll see as you scroll down a little further that it actually is okay. But this is just showing you the plan that you have right now going into the next year. So if you scroll down, all right, now we're seeing your plan with accurate information. It shows your premium is 0. And we didn't put any drugs in there, so of course your total costs for the year are also 0. There's no premium in this plan, and there's no expected drug costs. And then we have the pharmacy 1 out of 1 in network. So this person right here, no medications, already in the lowest premium Part D plan available in 2025, they're probably not going to change their plan. I'm not sure why they would. You can see more plans down here, but they're going to be more expensive. Higher premium, higher overall costs. The system defaults to lowest drug plus premium cost. So you always see the lowest cost plan at the top when you're getting your results. So this person doesn't have to do anything. They would let the plan auto-renew into 2025 and take no action. So let's add one little thing to this scenario, and that is a couple cheap generics. So the couple ways to add your drugs, the first one is to add it right here. And the other one is to go back up to the top, click on your name. Under My Information, click on My Saved Drugs. Either way, it's going to take you to a spot where you can add more medications. So let's go ahead. So we have nothing here. So we're going to add some medications by clicking on Add a Drug. Let's do amlodipine. There we go, add drug. Let's say it's 5 milligrams and we're taking it once a day, so 30 pills filled every month. If it's different for you and you get 90 pills every 3 months at the pharmacy, you can do that. Add to my drug list. There it is. Let's add another one. Metformin. At first glance, it doesn't look like you have the right one, but if you go down a little further, here's the regular metformin, metformin hydrochloride, or HCl. Add drug. You can see all the dosage options. There's quite a few, so make sure you're choosing the correct one. A common one is 500 milligrams. And we'll go with 2 times a day, so 60 pills filled every month. Add to my drug list. All right, so now we have our 2 generics that we're going to add. Let's click on Done Adding Drugs. You're back at the results page. Again, it shows your current plan. It's not going to show you much information, so really ignore this. This is just knowing that the plan is the WellCare value script that you currently have. But if you scroll down, now you start to see the results. Here's your plan next year. It shows the one pharmacy that we have in the system is in network. And then there is no premium for this plan and no expected drug costs. So that means that both of those medications are tier 1 generics, which you'll see a little bit later. There is a deductible in this plan of $590, but it doesn't apply. If it did apply to those 2 medications, you would have seen something here. So that's a way to tell. We'll go ahead and look into this, but before I do that, I just want to add another pharmacy just for kicks. So view pharmacies here, or you can go back up to the top, click on your name, and go to My Save Pharmacies. We already have our existing pharmacy, Kroger, in the system, so we'll click on Add Another Pharmacy. And then you'll see results based on your area. I'll add Walgreens. Shows up on the bottom, and we'll hit Done. And then OK. It confirms your drug list again. Yep, there's the 2 we added. You can click on Done Adding Drugs. Click on Let's See Plans. Sometimes the system will have you verify the type of plan you're looking at whenever you kind of go back and forth. So make sure we're selecting Part D drug, Medicare drug plan. And we'll get the results after it loads. All right, so again, we'll skip this. This doesn't really tell us much. We need to go down to here, and our plan shows up first. So our existing plan is still the lowest expected cost plan. Both of our pharmacies are in network, so that's all good news. Let's go in and look at it. Plan details. No drug costs listed here. 0 premium plan. $590 deductible. Unfortunately, Medicare.gov does not show you which tiers of drugs this applies to. You can figure it out as you look at the details, but it's not always obvious. I'll show you that in a little bit. Here's our list. We have this one here and the metformin. This plan has both pharmacies in network. They're also both preferred pharmacies, so that would be the lowest cost medications at one of those locations. If it just said in-network, it's a standard pharmacy and it's not preferred. You have your totals for each pharmacy right here, 0 and 0 for both drugs. And I'll show you in a moment how I know those are tier 1s. And then here's every month broken down for you. Adds up all your medications for January, 0. All for February, 0, and on and on. This doesn't show a whole lot because there's no medication cost. You'll see how it's different in the other scenario though. Now this is an important section here. You can click these plus buttons here to pull up some details on each pharmacy for each drug. So I'll choose Walgreens. And then it shows each drug and the cost in each phase of Part D. There are 3 phases, but I'll come back to that in a second. But then click on this, View More Drug Coverage. Down here, you're going to see this plan, how it's broken down for each medication tier. It doesn't say it, but it's tier 1, 2, 3, 4, and 5. Preferred generic is tier 1, they're 0. So that's why I know the prescriptions above that we added are tier 1, is because they have no copay. Your tier 2 generic is $5. Tier 3 brand is 25%. Tier 4 brand is 45%, and your specialty tier 5, 25%. So knowing that, that's very helpful. Now also, here's another tell. Go a little further down, you can see each drug, it shows you the tier down here. So that really gives you that verification right there. All right, back up here, we'll see cost before deductible, 0 and 0. Because the drug costs 55 cents and 85 cents and it shows a cost of 0, you know that it's a tier 1. And then so this is all just easy in this situation. No copays, so let's not belabor the point. This is the plan that person would go with. So they're staying with the WellCare Value Script plan for 2025. Now we're going to pivot to the second scenario. Someone who's taking some brand name drugs. We're going to see how that impacts the analysis in the plan choices. But real quick, with the new Part D rules taking effect in 2025, a $2,000 cap on drug costs, and the removal of the donut hole, this whole process has been simplified. You really just need to make sure your medications are covered on your plan's formulary list of drugs, your pharmacy is in network, and hopefully the plan premium isn't too high. So we'll go back up to the top and click on our name and choose My Saved Drugs. We'll add another drug. Let's go with Lantus. It's an insulin. It's the pen injector. And we'll say that a person gets a 5-pack per month. So it's already defaulting to that. But if you only get like 1 a month or 2 a month, you can choose this and then choose the amount. But let's just stick with the 1 quantity of the 5-pack. And the frequency is very important with the insulin. For whatever reason, if you choose every 2 months, it's not going to calculate correctly. So you'll want to choose either every month or every 3 months with the insulin. Otherwise, you're going to see something other than $35 or $105 for 3 months. So we'll stick with 1 month, add to the list. We'll add another, Synthroid. This is an example of a drug that has a generic available, but we're going to keep the brand. And let's say it's the 125 micrograms once a day, so 30 pills every month. Add to the list. And I want to show you one other really fast. What if you take Armour Thyroid? Well, that doesn't come up. There's no results for this medication. So if you take a medication where you get no results, check the spelling to make sure you have it right. But maybe it's just a drug that no Part D plan covers. So that's why you might not get any results. And occasionally you might have to put a brand name drug in and then have the system ask you, do you want the generic to get it to work? All right, so let's just go back to the drug list. We have our 4 drugs in now. We have our 2 cheap ones, and then we have the insulin and the moderately priced brand name. Done adding drugs. And this just takes you right back to where we were in the previous plan. So let's just go back to the plan results, scroll past this, and look what happens. This Cigna plan becomes the lowest cost plan because of the addition of those two medications. The premium is $1,570. The total plan costs are $973, so that would be total drug copays for the year, plus the $1,570 a month premium for 12 months. $590 deductible is part of the $973 total, so just keep that in mind. And we have one of two pharmacies in network, so that's going to be key here. We want to make sure we use the right pharmacy if we go with this plan, because not all the time are they all in network. Additional plans are going to be further down, like this one here with Humana. 2 of 2 pharmacies are in network. So you don't always choose the lowest cost plan. Sometimes you choose one that's a little bit more expensive but has your pharmacies in network. But I'll go back up to Cigna. Just for our example, we'll click on plan details. We have the premium and we have the total pharmacy cost of $785 right here for 4 drugs covered. This plan has a $590 deductible. Here's our list, the 4 of them that we added. And so if you realize you goofed up, you can change it right here. You can also add more pharmacies right here. So take a look at this. Walgreens is preferred, but Kroger is out of network. It's not even a network pharmacy. It is out of network. So you do not want to go to Kroger in this plan. You'll pay way too much. And you can see that right here. Here's your list at Walgreens and a total of $785 for the year. And then if you go to Kroger, it's about $8,000. So this is a nice spot on this analysis because it tells you, oh, okay, that's not the right pharmacy for me. In this plan, at least. And then as we go down, you can see the monthly breakdown. So at Walgreens, you can see January is $81, February $81, on and on. And then about late summer, it starts to drop to $43. So the reason why this would drop is you have now met your deductible, the $590 that it mentions. So let's take a look at that. When you click on the plus signs, remember you'll see the details for each pharmacy. We know we don't want to do Kroger because they're out of network, so let's click on Walgreens. And then also we need to open up this one here. We'll scroll down a bit and we'll see, okay, here's our 4 drugs. We got a tier 1 and a tier 1. We already knew that from before. Lantus is a tier 3. Synthroid is also a tier 3. If there was any prior authorization, it would show it here. So that's where you have to get approval from the plan to purchase the medication. So as long as it's the appropriate reasons to take a certain medication, it'll be fine. And if there's any quantity limits or step therapy, it would show up here. All right, so coming back up here, you'll see that tier 1 are 0, tier 2 are 5, tier 3, 18%, tier 4, 50%, tier 5, 25%. We know we have tier 1 and tier 3. So the amlodipine is 0, Lantus is 35, which makes sense. A covered insulin would be 35 at most for a 1-month supply. Metformin is 0, Synthroid 46. So there's our 81 that we saw up above a moment ago. After the deductible's been met, so in this scenario, it took about 7 months to get there, you have this column and you'll see the price of the Synthroid drops from 46 down to 8. Everything else is the same. And that's why you pay $43 a month the rest of the year. This person will not reach the $2,000 cap that they have for 2025, so you can really ignore this section. But overall, it looks like good coverage for this person's medications at their pharmacy, so Walgreens in this case, in this plan. All right, so let's head back up to the top and click on the plan results to go back to the options. What I want to point out is if you are going to enroll in this plan, let's say this is the right plan for you, different than your current one, then once you're between October 15th and December 7th, you will see an enroll button here in this lower section of each plan. It doesn't show it right now because it's not October 15th yet when we recorded this, but it will show up there. And that's how you'll proceed with the enrollment. All right. Now we need to add one more medication to really mix this up. So this we want to get it to where someone has, hits the cap, gets to the catastrophic phase with Part D. All right, so let's go back up to the top, click on our name, My Save Drugs, and let's add Ozempic. All right, let's say it's the 2 milligram pen injector, and you get one of those pens per month. Add to my list. Let's do one more, Eliquis. Let's say it's 2.5 milligrams twice a day, so 60 per month. Add to my list. So we've really beefed this up. We've added some significant costs to this analysis, and we'll see what it does to our results. Done adding drugs. Takes us back to the results page. Skip this first part and go down to the results. Now we have a different plan in the mix. United Healthcare, the plan premium is much higher. It's $89 a month. And both of our pharmacies are in network, so that's good. And then we have total expected costs of $17.67 for the year. So that's all your drugs combined with the $89 a month premium. And we'll click on plan details to see what this looks like. So out of that $17.67 total that you just saw, $697 is the drug cost. So you might be thinking, wouldn't that list of drugs get you to the $2,000 cap? Yes, it is. I'll show you what happens here. So this plan is a high premium plan that does not have a deductible. And those plans are typically called an enhanced Part D drug plan in 2025. So you really don't have to even reach the $2,000 cap and be done for the year. So let's take a look. Here's our 6 medications. Both pharmacies are preferred, so that's good. Here's our list of medications, total cost for the year for each drug at each pharmacy. And we see $697. Whether it's Walgreens or Kroger, $697 is the total. All right, so here's our month to month. $186, $186, $186, $139, and then it's zero the rest of the year. Well, that's nowhere near $2,000. Again, it's because of the enhanced setup of this plan, you get credit for more than you actually pay. So this person has very little drug costs for some pretty expensive drugs, but they do have a higher premium to achieve that result. So there's a little bit of a give and take here. Let's go down and look at the pharmacy details. So you can see where this all came from, but let's also click on the View More Drug Coverage. So let's check our tiers. So we got tier 1, 3, 3, 1, 3, and 3. We do have a prior authorization for the Ozempic. So Ozempic, you'll have to get approval from the plan to fill it. Your prescribing doctor would provide that information to the insurance plan, and they would work on getting that approval. Back up here, we have tier 1s are 5, tier 2, 10, tier 3 is only 47 versus a co-insurance. Tier 4 is 40%, tier 5 is 33%. So when we go back up here, you can see the total retail cost of these drugs is $1,659 for just 1 month. But what you're actually paying is right here. So what you'll notice is there is not a cost before deductible column. There is no deductible in this plan, so they just take that column away. So cost after deductible is the initial phase in Part D. So it's 5 for this, 47 for the Eliquis, 35 for the Lantus, which makes sense, 5 for metformin. Ozempic is only 47, which is amazing. It's really $929, but this plan is saying you only owe 47. And then Synthroid is 47. So there's your 186 that you kept seeing above in the month-to-month breakdown. And then once you hit that cap, once you've reached that 2,000 catastrophic cap, which in this plan you reach way quicker than actually spending 2,000, you see the zeros for everything. So this is kind of funny. Everybody's hearing about the $2,000 cap, but this example is where you don't spend anywhere near 2,000 and you're actually done. So let's go back up. I want to show you a different plan where you would be closer to the 2,000 or maybe even right at the 2,000. So a standard Part D plan, not an enhanced one. So this Cigna one that we looked at earlier, it doesn't quite get to 2,000. Let's see if any of them actually do. All right, let's try this one right here. We're getting closer to 3,000 in total cost when you include the premium of $83 a month. This one might be where you hit the max. Yep. So $2,000 on the dot is the cap that this person pays in this Humana plan. Has an $83 a month premium, $590 deductible. So this would be a standard plan. Unfortunately, it is a high premium plan and it still has a deductible, but it's a standard plan. So just because you see a high premium doesn't mean that it's going to be an enhanced one where you only pay a smaller amount for your medications. So we'll go down, jump down to what we saw earlier. You're going to see that roughly $2,000 out of pocket. You still see where you hit your cap about halfway through the year, about June, but your costs are obviously different than the other plans you saw. This, first month, $818. That's a big difference than that other plan that was about $185. We'll click on Walgreens and we'll click on more coverage. So we have Tier 1 and 3, just like the other plan. We still have a prior authorization for Ozempic. So let's go back up. And you can see here, this deductible does apply. So you're paying these numbers here for your medications. Now, your deductible in this plan was $590. You're not going to pay the deductible more than once. So just one of these drugs, like the Eliquis, pretty much gets you there. And then the Ozempic definitely gets you there. So you aren't going to pay $1,581 for all your drugs the first time you fill it. You just saw right up here that it was $818 in that first month. So ignore this total right here. That's not going to be really accurate. After the deductible's been met, now we're looking at $387 per month to fill everything, which should be February up here. Yes, $387, $387, $387, and then in May you're just about to the catastrophic, so it's a little less, and then in June it's $0. So this is an example of somebody, lots of drug costs, and they're in a standard Part D plan where they pay the full $2,000. The one that we just did prior was an enhanced plan where you're paying significantly less than $2,000. So that's how you want to look at these. When you're back at the search results page, you're really not going to scroll down too much. I'm doing that just for example purposes, but you're going to look at the top 2 or 3 plans. So this one right here looked good. You might look at this one and maybe the third one, but after that, it's just going to get more and more expensive. All right, well, hopefully this gives you the tools and tips that you need to review your plan and find the right one for 2025. Thanks for watching. Hey, if you like this video, be sure to watch our other videos right over here. Thanks for watching.